This is the first of 5 fairly short videos about major branches of the brachial plexus, and we're starting with the musculocutaneous nerve. As we know, musculocutaneous nerve comes from the lateral cord of the brachial plexus, carries fibers C5, C6, C7, and interesting anatomy that we will see shortly is that it runs through the coracobrachialis muscle. It is not the usual scenario that nerve pierces through a muscle, but this time we have it as some kind of unique situation. Innervation that we are expecting musculocutaneous nerve to provide is just for 3 muscles on the anterior arm. The coracobrachialis muscle, which is attached to the coracoid process and to the shaft of the humerus, primarily shoulder flexor, but also could be seen as shoulder adductor, I apologize. Then biceps brachii with its 2 heads, short and long head, being attached to the coracoid process, short head, long head, supraglenoid tubercle. And of course, then insertion is on the radial tuberosity and onto the forearm fascia with its own bicipital aponeurosis. And most importantly, it's the brachialis muscle attached to the distal third of the humeral shaft, and its insertion is on the ulnar tuberosity, and the brachialis is considered to be the principal flexor of the elbow, whereas the biceps is listed as the principal supinator. However, after it completes the supination, biceps brachii will be a very strong collaborator in elbow flexion. C5 and C6 fibers are needed for innervating those 3 muscles, and then the rest of the nerve passes subcutaneous and continues innervating the lateral aspect of the forearm. Let us take a look into one of the images. As you can see here, although it is quite small, we have the coracobrachialis muscle. We can immediately spot the nerve which runs through the coracobrachialis, but next image is certainly much better because it is quite large and it doesn't have other structures that eventually are obstacles. Here is the coracobrachialis, here is the musculocutaneous nerve passing through the belly of coracobrachialis, and then it continues running in between coracobrachialis and brachialis, deep to the nerve and superficial to the nerve biceps brachii, which has been pulled sideways, pulled more laterally to show those peripheral branches that are entering muscles that musculocutaneous nerve innervates. Once it has completed innervation of the anterior arm muscles, the nerve comes out on the lateral side of the elbow and continues on the lateral forearm. As you can see, it's more anterior lateral than just lateral, and from a posterior direction we can see here another aspect of skin which is innervated by musculocutaneous nerve. At this point you can start thinking also about differences between what is one dermatome versus innervation, cutaneous innervation of skin provided by particular peripheral nerve. You really have to start thinking right away, regardless which nerve you're looking at. It does have certain fibers that it carries. So if a nerve is carrying fibers of C5, C6, C7, as the musculocutaneous nerve is doing, basically it is very difficult to determine just on the basis of its composition what exact part of the limb it is going to produce the cutaneous innervation. For us, basically, it is in anatomy that we add certain names. So if we go quickly back to previous image, you can see here that musculocutaneous nerve and the branch which we're talking about being cutaneous actually has 2 branches, anterior and posterior. And what is even more interesting is that nerve actually changes its name. It becomes the lateral cutaneous nerve of the forearm. And that is what confuses students quite a lot at the beginning of their career in the field of medicine, because you really have to just go backwards and think about definition of a dermatome. So what is dermatome? It is patch of skin which is innervated by single spinal nerve. So by saying by single spinal nerve, it really does not include what that nerve might be doing. Is it part of the brachial plexus? Is it not? So we're thinking in this case that we're talking about one single spinal nerve, whatever its number is it cervical, is it thoracic, is it lumbar, and its sensory fibers will be given perhaps to multiple nerves with the proper names, but the patch of skin is actually going to be always innervated by same origin, same spinal nerve. We'll take a look also in one of the videos to dermatomal diagram to say a few words about this. And for now, I think that this would be more than enough to cover all of our needs for information about the musculocutaneous nerve. Please stay tuned and watch other videos in the playlist that will be talking about remaining 4 branches of the brachial plexus. Anatomy Made Simple by Dr. T.